So I'd like to welcome you to the second Clinical Strategy podcast. My name is Charlotte Routh. I'm one of the Trust Clinical Strategy Leads. And I'm pleased to welcome you today to this podcast, which is focused on virtual wards. So I have three members of the virtual ward team here today. I'll introduce them. We've got Helen Smart, who's General Manager, Karen Hudson, who's one of the nurse consultants, and Jen, who's one of the clinical leads. So some of our clinical strategy aims are around supporting new ways of working and pathways that reduce movement around our system and our patch for patients, and also about supporting care in other settings and in particular keeping patients in their own home. So we're going to just talk a little bit about virtual wards and get a little bit more information from the teams about what they are. So Helen, I think you're going to start about telling us about what the virtual wards are.
Okay, so a virtual ward is it's a national initiative that came about in 2022, and it actually is an alternative to a hospital-based care. So it's about providing hospital care in a patient's home, whether that be in their own home or a care home, and it helps to get patients out of hospital sooner, but it also prevents a lot of admissions. So in turn, this ultimately provides capacity within the hospital for our sickest patients so that we have people in the right place receiving the right care.
So when did the virtual ward start?
So we actually had our first patient in December 2022.
Oh, so quite a while ago now.
Quite a while ago. We did start slow. It was a gradual increase in patients. Now we approximately had about 75 patients a day on our virtual wards. This can increase, and it has increased to about 100 when the hospitals have been under pressure. But on average, it's around about 75 now. Like I say, we did start slowly. We tried to build up confidence with our colleagues, build the systems and processes in place, and just making sure that it was safe for our patients.
So Karen, I think you're going to tell us a bit about who's looking after the patients on the virtual ward.
So ultimately it's a consultant or a medic who's responsible for all the patients on the virtual ward, but the majority of care is taken over by the nurses, the therapists, our community nursing colleagues, other healthcare professionals, and the specialist teams that we'll work closely with, such as respiratory and frailty.
So are you working with anyone outside of the Trust as well to support your patients in virtual ward?
So we work with carers, families, our GP colleagues, frailty nurses, people from different other organisations, such as the voluntary sector. We work with social prescribers, lots of different organisations, and we also link in closely with our colleagues wider. So we've got colleagues from different areas such as Newcastle, Cumbria, who want to come and see how our virtual ward works, but also gain a little bit of knowledge and understand how we do things.
That's great. So real collaboration with lots of people by the sounds of it and lots of teams. And since you started, how do you think the virtual wards have progressed?
It's been a gradual process, to be honest, ensuring we had all the systems and processes in place, gaining a lot of that trust and confidence, winning the hearts and minds of people, really. And a lot of work has been done with engagement and understanding that we can make a difference in the community. We started with step down, so a lot of work was done with our acute colleagues in different specialities. Really keen implementers, so people who wanted to work with us kind of understand what we're doing, and we wanted to showcase kind of what we're doing in the community and how we could manage these patients.
And can you just explain to us what step down means for people who don't quite understand that?
So step down is these are patients who are on an acute hospital ward. It could be in one of our Northumbria Hospital, or it could be on a base site ward such as Wansbeck or North Tyneside, who are having acute hospital level care, but actually we think we can get them home earlier with support and through virtual ward.
Okay, so you're getting them home quicker than they would have normally?
Yeah.
Okay.
Earlier discharges, yeah.
Okay, so it's been a progression. It sounds like it's been a journey, but you're now up to having a lot of people managed at home, which is really great, who would have been in hospital beds. So I think, Jen, you've got a patient story for us.
Yeah. So we see lots of different patients from lots of different specialities, but one of the more popular ones, or the one that's used the most, tends to be a cellulitis pathway. So this particular lady was an 82-year-old lady from North Shields. She had no poor mobility and had no transport to get back for daily IV antibiotics. She also had minimal family support and a cat that she wanted to be at home with. So we took the referral, which is digital, from ambulatory care on the cellulitis pathway, which is a pre-approved pathway. The referral was triaged by our staff at our base, and we contacted ambulatory care for the plan. We made sure everything was in place for the delivery of the care at home, and we were able to get this lady home. She'd had her first dose of antibiotics in ambulatory care, and we were able to complete the pathway at home, so seeing her daily for antibiotics, and then we helped to encourage her to do her oral switch, and then kept an eye on her for a day or two and discharged her.
I think that's really important, isn't it?
Yeah.
Because actually coming from people's home to hospital can sometimes feel like a very long way for them. It's very time consuming.
And this lady didn't have transport, so it saved the ambulance service and her waiting around for that as well.
Okay, yeah. And did she give you any feedback about how she felt?
She just thought it was marvellous.
Yeah.
Her words.
Yeah, okay. And is she normally by herself at home?
She is, yeah. She's a frail lady who lives alone, just with her cat. Very little family support, so it really did make a difference to her.
Great, okay. And there's probably lots of other patient benefits to people being managed on the virtual ward. Okay, who's going to tell us a little bit about that? Karen, thank you.
So for us is really, we know that patients, it really does improve their mental health and their well-being being at home. Early discharge also we know reduces the risk of infection, prevents deconditioning, and when you're in hospital it can be a little bit disorientating for people, so actually when you're at home we know that's the right environment for people, and we have found that it accelerates recovery and it can boost your morale, and you kind of get that sense of freedom back. You're back in your own environment, you've got all your familiar surroundings, you can, your family can visit when they want to visit, so it does have some real benefits, and it's about that right personalised care for that person at the right time.
Yeah, and I can see that because actually a lot of what we do to people in hospital, we put them in a very false environment, don't we, where we sort of wait on them, give them their cups of tea, and promoting that care is really great in their own home.
We've also found that, I suppose, it increases mobility. So, in your own house, you're pottering around a little bit more. You've got, you've got your familiar surroundings, so it does really make that difference.
Like diet and nutrition as well, because you're eating your own food, you're making your own food, fluids and things.
And how have you found going into people's houses? Have they generally welcomed you in?
Never been an issue. It's obviously it's quite a privilege to be allowed to go into someone's home, and that's always nice. And I think the staff are very, you're very conscious that you're in someone's home, but seeing how they're managing their own environment, and you can get quite, just walking through the front door, a really big picture of what's going on.
Yeah.
I also think it's really helped confidence for patients, because actually you've got this kind of different wraparound care that you wouldn't have got before, and it's shown what we can do for patients within their own home, and actually you're getting it in the place you want to be. So that added value, I really think it can't be understated.
And I think the family really appreciate it as well. I think they don't like to see their families, their loved ones in hospital. They like to see them kept in their own home where they can.
That's great, yeah. And I can see you guys have got loads of energy. So can you tell me what the staff think of it?
Staff love it. Jen's a prime example, but we've had brilliant feedback from the staff. It's shown in our recruitment. We don't really struggle with recruitment now. And I think they've been able to use their skills and develop their skills, so they get much more satisfaction out of their work. And I think all the relationships that the staff have built with their acute colleagues, the primary care, that's really just gives them a boost in their working day, and just seeing those successes as well.
The cross-working's definitely been beneficial to all of the team and to the patients as well.
Yeah.
It's sometimes you see a patient in hospital and then they see you out in their own home, they're like, oh.
Yeah.
So I think they've quite enjoyed that.
Yeah, great. And it sounds like you've been on quite a journey, so your staff have obviously been involved in lots of change and being heard and seeing what works and what doesn't work. And that, again, gives loads of people energy, doesn't it?
Absolutely, yeah.
Yeah, great.
It's exciting.
Yeah. So what's the future for virtual wards?
Well, we have challenges ahead of us. I think, as you say, Charlotte, we have come a long way, but I think there's a lot more we can do. And I think we have got an established model now. I think there's a lot of other areas and specialities that want to be involved with virtual ward, which is a really, really good positive. But I think we've still got those challenges of the rurality and the geography of Northumbria. I think we need to continue working with our district nursing teams and our therapists out in the community, because we couldn't do this without them. It's such a widespread geography. IT is always a challenge, always. But the IT team have been great with this, and they've really supported us, and they've solved problems where they could be solved. So it's really good. Pharmacy as well. We've had a lot of areas come to visit us to see how we manage the pharmacy, because the pharmacy, sort of the safety of the medicines and everything in their own home has been a concern. But we've got a really good pharmacist, Andrew, and a couple of technicians, Rachel and Amanda, who really integrated in the team, supported the specialist teams as well. So that's really, really quite a good model that other people have been interested in. So, and they've helped us troubleshoot a lot of the things. And as communication, it's always and always will be a challenge. I think we've done a lot, as you know, with communication, but we can't stop. We've just got to keep going with that and promoting what we can do, because for all it is well known in the Trust now that we can deliver virtual wards, there are still pockets there where we could do better with our communication. So we just need to keep going with that, and we just have to prove our worth now. That's our challenge.
Yeah. So I think, Karen, you talk quite a lot about people being stepped down from hospital care. Are there any plans for the future about people preventing people coming into hospital in the first place?
Yeah, absolutely, Charlotte. Admission avoidance is one of our key kind of target areas that we're wanting to concentrate on now, really. So we're looking at our step-up model. We are working with our GP colleagues, our Northumbria Primary Care, our frailty colleagues, our geriatricians, the whole of the wider kind of Northumbria team as well, the community, our acute colleagues, just getting ideas, listen to what people's views are, our patients and carers, and also thinking about how the model can look. So we're looking at patients within care homes maybe, or to our response patients. So if we've had a clinician go out and see someone, could be for a cellulitis, could be for an acute kidney injury, whatever that may be, do they need to be stepped up on the virtual ward instead of coming through the front door of that hospital? So that is a big focus for us now. So we're just in initial talks, but it's kind of watch this space.
Well, thank you very much for coming to talk to me today. I think you've got a great project going. It's clearly evolving. It's keeping people out of hospital. It's getting people home quicker and providing care in their own homes, which is great. So thank you very much.
Thank you.